The outbreak of GBS syndrome is causing alarm bells in Maharashtra to ring. With more than 101 cases confirmed and one suspected fatality, the issue has become very important in context of health in the state. 16 patients continue to be on ventilator. The suspected GBS death occurred in Solapur, where the patient, originally from Pune, died after developing symptoms like cough and cold. Now the issue is, what GBS is. One, it's an autoimmune neurological disorder. The immune system of the patient attacks the peripheral nervous system. This leads to weakness and numbness that can progress to paralysis. It can develop over a few days or several weeks. The exact cause is unknown, but it often follows viral or bacterial infections linked to bacterium found in undercooked poultry and unpasteurized dairy. Now, let me play out the bite of the Health Minister of Maharashtra, and then I'll straight away go to my expert as to what is happening in Pune.
पुणे शहर में जीबीएस सिंड्रोम के पेशेंट्स बढ़ रहे हैं, उसके कारण पुणे में थोड़ी सी चिंता का कारण बन गया है। लेकिन मैं अपील आपके माध्यम से करता हूँ कि ये जो पेशेंट्स है उसके बारे में हमारी जो डॉक्टर्स की एक्सपर्ट टीम है उसका ओपिनियन आज कल आ जाएगा, और पुणे महानगर पालिका और हेल्थ डिपार्टमेंट ऑफ महाराष्ट्र दोनों मिलकर अच्छी तरह से इस जीबीएस के सिंड्रोम के पेशेंट्स ना बढ़ पाए इसके लिए अच्छी तरह से काम करें। अभी तक 101 पेशेंट है, उसमें से 73 पेशेंट जो है वो डायग्नोस हो गए कि जीबीएस सिंड्रोम के वो पेशेंट है, लेकिन उनके अच्छी तरह से हम लोग देखभाल कर रहे हैं।
I'm joined by Dr. Ishwar Jilada, communicable disease expert and Secretary General, People's Health Organization. Thank you so much, sir, for joining me. My question is very basic, sir, on the GBS, as people would like to know what has caused its spread in Pune.
Thank you very much for having me on the show, and I'm really glad that you are going to basics. So basically, this is a almost 100-year-old infection, which has been notified or identified first time by Dr. Guillain and Dr. Barry. And despite 100 years of knowing this syndrome, we do not know the cure. We do not know how to prevent it. We do not have any vaccine for it. And we hardly know actual causes. But it is always secondary to some causes. And those causes can be either bacterial or viral infection. The infection can be either in abdomen, that is in diarrheal diseases, or it can be in respiratory diseases. Or it can be secondary to some other infections like chikungunya, or taking any vaccine, or any other infection. But we cannot know from which one. But here, at least in this cluster of cases in Pune, we know that all of them are having diarrhea. So it is basically a gastrointestinal infection which has subsequently caused GBS. Secondly, they found that they are from villages which are part of Pune Municipal Corporation, but the water supply is not of the PMC. That means water supply is not clean. And it is pathetic situation that after 78 years of independence in this country, we are not able to provide potable water to our people. So we talk very big. We want to go on Mars and we want to go on Moon, but we are not able to provide a basic minimum requirement of a clean water. And if clean water was provided, they would not have got infected. They would not have got GBS. Now your second question is, a second thing you would like to know is what is basic happening in the GBS.
One more thing, doctor. One more thing. A lot of people are having this idea that it has zoonotic origin. Is it correct?
What is the question?
A lot of people think that it has zoonotic origin, something to do with the animals, the poultry. Is it correct?
This is not. What they think is correct, because most of the infection in the last 40 years are spreading through animals. They are zoonosis, zoonotic disorder. But this one is not. This one is spreading because of some infection in cluster and then that is leading to GBS. So on one hand, it is very important to provide succor to those people, care for them, make them as soon as quickly as possible walking on their feet, prevent death. But on the other hand, so many cluster of deaths never patient did not happen earlier. So it is a very important to know that one particular infection is leading largely to this GBS, and currently they found that it is a Campylobacter bacterium jejuni. Earlier they thought E. coli, which is very common, but here it is Campylobacter. So when we know that one particular infection is causing GBS, so I think we need to do a lot of research to find out the connectivity between that infection and GBS. Number two, here a lot of young people are involved, even children are involved. So we need to look at the possibility of infection. Why in young people? Usually it should have happened in the older people.
Okay.
And thirdly, at present moment, we need to provide, because we can make compartmentalize what can be done by community.
Dr. Gilada, I know a lot of people would like to know from a doctor, if you don't have a cure, what is the prevention? Or we don't even have a prevention for this GBS.
In current episode of infections, the best prevention is clean water. And clean water, so long as PMC is not, Pune Municipal Corporation is not supplying water, till that time you need to provide them clean water. And if it is not clean, you can have a chlorine tablet put in water and before drinking. So the chlorination of water is very important. Now they are ensuring that chlorination of the quantity which is enough to kill any kind of bacteria, viruses is being done, and it's still potable. That is being done. Secondly, we should avoid eating from open cafeterias.
Sir, is it communicable, sir? Is it? I'm asking these questions because we're going to replay this interview. Is it communicable, sir?
No, GBS is not communicable. GBS is not transmitted through respiratory or any kind of other communication system. It is secondary to infection. So the primary cause is communicable, but the secondary cause GBS is not communicable. So one cannot get GBS by treating patient, by caring patient, by keeping the patient at home. You cannot get that.
Okay. So you are saying that this GBS outspread is very particular and localized Pune phenomena emanating from dirty water?
Yes, at present, yes, but GBS has been known to us, and we see sporadic cases of GBS all over the country, all around the year. But they are far and few in between. Kind of even typical specialists, which are gastroenterologists, also will see GBS maybe 3 or 4 cases in a year's time.
Okay.
But you do not see so many cluster of cases coming to, and it is going on for last 8-10 days. It's even today we added another 25 to 30 cases, and they are almost 24%, 25% of them are landing upon with the fact.
I think, sir, you made a very strong point, and on that note, I would like to conclude this interview. When you said that, we think of going to Mars, we think of conquering the moon, I think the first thing we should think of doing is to provide clean water to the citizens of this country. And if the GBS actually, as you are saying, is a result of contaminated water, then I think it's shameful that even after so many decades of our independence, we can't provide clean drinking potable water to our people. So that's all on point 2. On the other side, we will discuss the dedicated anti-extortion cells set up by the Manipur government. So don't go away. And why have they done that?